are you today?
I'm good. How are you?
Good. Could you please briefly introduce yourself?
My name is Asuman Antepli. I am originally from Turkey. We came to United States because of my husband's graduate program. While he is doing his program, I decided to do a nursing study in the United States. I graduated around 2013 to 2014 from the North Carolina Central University. We currently stay in North Carolina. I have two children, 21 and 24, and they are graduated from the college. And my husband is currently a professor at Duke University.
Great, that's awesome. So what is your position here at Whitetulip Healthcare Foundation?
So my position is being evolved over the year. I started the Whitetulip organization because of I wanted to help with the international nurses who came to the United States and who really trying to understand what nursing is in United States, what's really mean for them, how do you study, and what is the work conditions, and is there anything that they need to do before they got into the hospitals, or what is the work conditions are. So initially my intention was from 7 to 8 years ago, basically try to help the international nurses try to understand the American cultures of the nursing. And as we know, nursing is a big respected profession in the United States. According to many research, they are the most reliable, most respected, one of the very respected occupation in the USA.
Yeah. So what inspired you personally to pursue a career in nursing, especially specifically in the United States?
In the United States, I think I started from the individual, how they really know themselves. As a person, I think that my personality is, it's not try to be in the computers. I am not a computer girl, as you can imagine. And I really know that I will be not very happy with the computer, like a computer science person. It's not like discrimination against me, just not me. So I decided to start looking for something that it's in the community and it's something that touch with the people's lives. And I actually wanted to communicate with the people who lives in the United States. And if you're invisible in the community, you actually know better why you are living, what your surrounding is. Basically, two things. One of them is I cannot survive in the cubicle area as a computer majors, and I'm socially very active, and I speak a lot, I talk a lot. So I think the initial senses for me that I wanted to something that with the people related.
That's great. That's awesome. How did you start the process of becoming a nurse in the United States?
So it was initially very struggle because if you're something that you're pioneer of, it's you get all the difficulties and struggles if you don't have a kind of mentors and any kind of people who shows you the way. It actually works. So my thing is, if you don't know something, you're scared a lot.
Oh, yeah.
So if you don't know anything that in your culture or in anything in the social norms, if you don't know, either you hate it or you're scared. So my thing is, for the nursing, how I started, I started initially, as a pioneer, as a Turkish nurse in my community. Of course, there's many Turkish nurses, but at the time I didn't know anyone. So I started to something like you swim in the dark areas and try to understand and, try to manage. And it's more of like a touching and try to make sense of it. I really tried initially, I didn't know anything about it. What is the process? I started taking some classes and I learned about nursing and I decided to pursue nursing because of many things in my life at that time. So it actually started that way, and inspirations of it's just my personality, I think.
That's great. So I remember you said you're the pioneer of nursing in America with the church community. So has Whitetulip helped you throughout your journey, or did you kind of start or help start Whitetulip?
So I want to correct one thing. So I am not the only one who's a pioneer.
Oh, yes.
It's just around my environment. I didn't know anybody Turkish nurse. So what I started is from the nursing point. I studied in nursing in the United States. So it's kind of give you a sense of what is the culture of the United States in the healthcare. How you deceive, how you receive, how you communicate. It teaches you a lot. As you are a nursing student, you know the cultures of the patients, how you make a rapport with them, how you gonna like an environment of like a family. Because if your patient doesn't trust you, how are they gonna trust you with their health, which is the very important part of their life. So initially, most of my year is try to understand and make sense of how I'm going to vision myself to be a nurse. So later on, how I involved with the White Tulip organizations, which is very confidential. It's just spontaneous evolving. So I was partnered with one of my Turkish friends who actually is very advanced in her career, has 2 master degree, I think better than I am. So we decided to help the Turkish nurses who came to United States and tried to understand nursing in America. So we make a group of it without knowing that White Tulips exist. So a couple of people, including one of them is your mother. So we're trying to understand where they are, where are they there in journey, how we can help, what is the missing puzzles of come the nurse in the United States, and what is the puzzle that they are missing in their life to become this dream is coming alive. So I came across White Tulip at that moment while we are trying to understand what's going on. And then president of the White Tulip organization, who I actually admire a lot, and then I think he has to get more of the healthcare survivors over here, all the praise. So he connected me, and then he said, if you want to do some kind of organization, because if you're something part of it, part of an organization, it's actually give you a lot of credibility. So if you do that, it's a little bit make your life better because you have a capability of organizing people under the name of the one organizations and who actually being trusted in the community. So one of the reach out to me that what about you come to our organization, you create your own curriculum, own syllabus, how you're going to help them, it's up to you. We are just here to support you. So this is how my journey is 7-8 years ago connected with the White Tulip.
That's so nice. Okay, one last question. So would you recommend other medical professionals attend workshops like we attended here today?
Absolutely. I think last 7-8 years we are doing the workshop of nurses every year, and it's also evolved, it's also changed. Initially we started with the simple question: what does it mean a nurse in the US? How you become a nurse? These are the steps. And how you're going to achieve this, what schools are available, and what's really nursing is in the future if you want to envision yourself to get advanced in nursing. Like nurse practitioner, you can do a doctorate program. It's unaware, something that rich career, unaware of the out of United States. I never heard any nurse practitioner who practiced as a provider prescribed medication in Turkey. I never heard about anything like any other European countries that it's actually capable of doing that. So first of all, we have to recognize how United States in the US is very largely recognize how nurses is important and how their role become at even like prescribed medications, being a site NPs, family practice NPs, which is after 7 years of doing these workshops, we have actually a lot of nurses that who actually pursue further advanced education, which is very plus, and I'm very proud of that. So my involvement of the White Tulip start from there, and it is currently, I think we started 2016 to 17 almost. So it's been evolved, and then our nurses are get better. So initially we started with how we become a nurse. Later on they become a nurse, and that it's also evolved the context of the workshops. We are talking about the problem in the workplaces, how we can advance and how we can be morally more supportive. The role of mine is also a little bit involved. I was started with the co-director of the nursing program initially, and I became one of the board members since last year. And it's a little bit difficult for me to, being a board member. It's a lot of bureaucracy, I think. But it's just to see how our nurses is going to involve, and that is so enlightening me that how other healthcare providers like doctors and dentists and pharmacists are involved in their organizations. For example, I was so amazed to see how doctors are being like educated and get them a mentors, and how their journey is as similar as the nurses. I think is more difficult than the nurses' journey, and I really was so surprised and awe of the organization, how they can actually find a way to understand the healthcare, and how they're gonna understand what are the struggles, and how they can actually make a path for those healthcare providers to survive in the United States in the healthcare, which is which is not easy.
It's not easy at all. All right. Thank you so much for your time.
You're so welcome. Thank you very much.
Thank you.